Hi, I'm Mo Lansing. I am an infection preventionist and nurse. And what I do is I try to educate team members, nurses, physicians, and other people who work in healthcare.
I'm Mary Miller. I'm a nurse by background. I'm a certified infection preventionist, and currently I'm working as a nursing educator for infection prevention.
And we lost our mom to a drug-resistant germ on Mother's Day.
And we went on afterwards to become infection preventionists. Infection preventionists, their whole goal is to keep the patients safe. So we're always trying to prevent infections. And if you imagine a hospital with a couple hundred patients, a lot of them came in with infections. We do not want those infections spread to anyone else.
What I remember most about my mom was that she loved her family. She loved all of us individually and as a group.
My mother was a dialysis patient, and then one day she developed a VRE bloodstream infection.
She became very ill, and on Mother's Day, she went back to the hospital for the last time, and that's where she died. And it was all related to this initial infection with the drug-resistant germ. I share my mother's story, and I have been sharing it since I became an infection preventionist. I think it helps team members, physicians, anyone that I'm talking to understand that the person that's in the bed belongs to someone and that every touch matters. I think it also helps them understand that it could be their loved one and what would they want for them.
I would say to anyone who prescribes antibiotics to be involved in antibiotic stewardship, or at least have good knowledge of it, and educate your patients. Antibiotics are not without side effects. Use them carefully. If you have culture results, make sure you're looking at the culture results and that the antibiotics are matching the results of the culture.
Cleaning your hands is not just before you go in a room and after you leave a room. It's around the bed. The patient and the environment are the critical points to remember that you're cleaning your hands.
But we cannot measure how many infections you have prevented. So every time you clean your hands, you are preventing an infection. Every time you get an intravenous out that they don't need anymore, you are preventing infections. When you wipe down the countertop, it's all infection prevention, and we cannot quantify that. We cannot tell how many infections you prevented, but you are preventing infections.